I thought maybe it's because, the average person doesn't really care about Gini coefficients and 90-10 ratios or Teal ratios, which is probably true. And thought maybe if I tell the story of inequality in the US from the perspective of inequality of well-being, maybe people would care more. And I'm not sure I succeeded at that, at making people care more. I think how bad the situation is has started to make people care more about inequality. Um, but I did find incredibly deep inequality of well-being in the US, but then also some really interesting puzzles in terms of why minorities are so much more optimistic than whites and report less stress and less worry and are incredibly resilient to negative shocks in a way that, particularly in the low-income groups, that low-income whites are not. Um, and once I found this, I started trying to track deaths of despair with these metrics, and they also actually they robustly match trends in deaths of despair. The sort of the lack of well-being that we find, or the low well-being and despair that we find in particular cohorts. Um, and then since then, and what I'm going to talk about mainly today is what COVID did. We had a despair crisis of about 70,000 people a year dying from either suicide, alcohol poisoning, or drug overdose in particular before COVID for about 15 years. So, adding up to a lot of death. And then in comes COVID and hits obviously the disadvantaged and vulnerable the worst. And then even though at first COVID hit different populations and deaths of despair, which are primarily white, and it mainly hit low-income minorities. Now it's spread to almost every county in the United States, and it's very present in some of the places at high levels of deaths of despair. So we have some evidence of increase in these kinds of death comparing the first 3 quarters of 2020 to the first 3 quarters of 2019. There's some other estimates that the employment and mental health shocks could lead to an additional 75,000 more deaths per year. I would hesitate to predict that. I just don't think we know enough. I also think that I know the COVID shock is going to add, problems to places that already have deaths of despair, but in large part, these places have very low population density, huge percent of the labor force already out of the labor force, a huge percent of prime age people. And I think it's very hard to take an estimate of what an unemployment shock does to overdoses, for example, which there are plenty of those kinds of estimates in normal times, to kind of what a pandemic does and what an unemployment shock in particular does in places that are already hollowed out, where they've already had the employment shock and they're already desperate. So I mean, sort of sad question is how much further can they fall? And the evidence certainly is that there are significant increases in mental health reports and overdose deaths, suicide a little bit less, but that may still be to come. But the most interesting part of the story, which is what I'm going to focus on, is that this remarkable resilience and optimism among minorities, in particular low-income African Americans, who are the group most hit by COVID, both in terms of incidence and death, in part because so many of them are essential workers, also Hispanics, but not quite as much as African Americans. But still, the well-being, the reported well-being of minorities is still much higher than whites, and in fact has dropped. I mean, everybody's had a bit of a shock, but the low-income African Americans, for example, have barely had a drop in their optimism. So this is not from Gallup data. We have the Gallup panel. We're starting to look at that. This is actually from a survey we did with Washington University in St. Louis, the Social Policy Institute, which I've been working with extensively. And it's a nationwide survey, and we had about 5,000 respondents per wave. Wave 1 was in April, May. Wave 2 was in September, October. We're just getting those results now, so I can talk a bit about them, not as much as I'd like. And about half of them are forming a panel. We're going to have 3 more waves. So if anybody has, just listened to this, suggestions of questions to add, or other things we can do in building this this sort of longer term database on this stuff, I'd really appreciate it, because there's still an opportunity to add questions in every wave, or to take bad questions out as well. I'm gonna skip that. Just this is kind of an old finding, but it's just a snapshot of how unequally shared well-being is in the United States. It's the US compared to Latin America. Income quintiles from Gallup, the Gallup World Poll, which the poorest quintile for the US is exactly sort of where the poverty line is for a family of 4 in the US. And this is, did you experience stress yesterday, yes or no? And as you can see, respondents in the US experience much more stress on a daily basis than in Latin America, which is also a very unequal place. But the story here is really the gap between the responses of the rich and the poor is so much greater in the US. So that, you know, it's just a snapshot of how well-being in the US is more unequally shared than even in Latin America. And here you get belief in hard work. If an individual in this country works hard, he or she can get ahead, yes or no. And again, you see that there's very little difference in Latin America between the rich and the poor and how they answer this question. In fact, there's no statistically significant difference. And for the US, the difference is very large, and the poor in the US are much less likely to believe that hard work will get them ahead than the poor in Latin America. Again, these are snapshots, but they certainly provoked my looking more deeply into what was going on to the well-being of the poor in the US. And this was about 2015, before we knew about the deaths of despair, or just before. And one of the things that surprised me was these high levels of optimism among low-income Blacks. These are only poor groups, and as you can see, poor whites, the left out group. And as you can see, poor Blacks are almost 3 times as likely to score a point higher on, this is a life satisfaction in 5 years question, which is essentially a open-ended optimism question. And then Hispanics are also more optimistic than whites, but the big difference is with low-income Blacks. And then, interestingly enough, if you look at right after I found these things, at first I was worried I had a coding error, but I kept rerunning it and I didn't. And then Anna and Angus's paper came out, the first one on deaths of despair, and this charts from that paper. But as you can see, US whites are the red line, where all-cause mortality for 45 to 54-year-olds, white non-Hispanics, is going up compared to the trends in every other rich country in this group. And then the thick blue line going down along with everybody else is US Hispanics. They didn't have a line for the data in there for US Blacks, but it tracks with US Hispanics. So Blacks and Hispanics have lower life expectancy, or had, they may have almost caught up by now, but they had lower life expectancy as a starting point than US whites, but they've been gradually catching up and their rates are still going down, as opposed to this trend for US whites, which is mortality rates going up and due to deaths of despair. For the 2018 and 19 CDC data, we are seeing an uptick in drug overdose deaths in older urban men on the coast due to fentanyl. These are former crack addicts who now are getting fentanyl instead of other milder forms of heroin. But it's not like a huge widespread problem as are the deaths of despair. So as I said, we started matching sort of our data on, in particular, lack of hope, and then stress and worry, which turned out to be the metrics that were most closely associated with county level deaths of despair. And this was at the individual level with race, and also county and MSA level. And the idea was, we just wanted to see if there was a robust association. And indeed, the probability of living in a county with high levels of deaths of despair was negatively correlated with optimism and positively correlated with stress and worry. And we're not claiming causality. If you're living in that kind of county, it tends to be hollowed out in the heartland. Manufacturing or mining firms have pulled out. If there are a lot of people around you overdosing on drugs and committing suicide, that may make you more likely to overdose or commit suicide. And there's sort of it's kind of a vicious circle. But certainly what we did find is that these metrics really correlated robustly with the trends. And then in another paper with Kelsey O'Connor, based on PSID data, we found that optimists live longer. Basically, these were cohorts born between 1935 and 1945 who reported to be optimistic or not in their 20s, and the optimists were much more likely to be alive in 2015 than the non-optimists. And we were controlling for all sorts of other things, of course. But what's interesting is that while Blacks and women increased their optimism in the 70s, exactly when civil rights and gender rights improved, the less than college educated white males began to have falls in their optimism, which have been steady since, in the late 1970s, right at the first wave of manufacturing decline. So if you think about it, had we been tracking well-being even 10 or 15 years ago, the way that you all are in Britain, we would have noticed that something was wrong with this cohort. Why has their well-being dropped so much? And I think that might have been a warning indicator before we had a full-blown mortality crisis. We also basically find that there are things about place and diversity that seem to play into this. One, it's just adding up the individual trends, and that minorities are much more optimistic than whites, report less stress and less worry. But we also find that that more diverse places tend to be more urban, and they tend to have healthier, more vibrant economies, not just dependent on one manufacturing firm. It's sort of like Richard Florida's story about cities and the creative class. Basically, cities have a lot more going on. There's some declining cities, but in general, and also people have to walk more. The people exercise more. They bike or whatever, versus in these hollowed out places in the heartland, everybody drives everywhere, and their health indicators are horrible as well as well-being indicators. You have much higher levels of obesity in these places, much more smoking. You can imagine what's happening now as COVID has gone to these more rural places. There's not only a shortage of hospitals, but people are just genuinely really unhealthy. And we actually found in a separate paper that's coming out in a bit that prime age males out of the labor force in particular have terrible health indicators, terrible well-being indicators. They also tend to live in their parents' basement. So it's not, you have an even more sort of unhealthy part of this population that's already addicted to opioids. That if they get sick with COVID, that they're very likely to have high mortality rates. The other side of that story is maybe they just don't have that more, they can't. How much lower can they go in terms of mental health effects? But again, we don't know that yet. And then what we've now been doing is taking the patterns in that research and adding in the COVID deaths of despair crises. We've been using the previous data was CDC data, but they lag about 2 years before they get an annual data set out. So we've been using the Hopkins tracker. We do use some well-being data from the Gallup panel and from our joint survey with WashU. But the other thing we've been adding to, because we can get real-time data, is the first responder data. We have first responder data from a US agency called NEMSIS, and they get data from the states, and so they track 48 states with real-time data from first responders. And we've been able to compare, for example, the numbers of calls for overdoses, for suicides, for mental health reports. And as I mentioned, there has been a big increase. So overdose deaths have increased by double from about, I think it was 2,000 per, it was something like 2,000 to 4,000 just from, that's only deaths reported in those who call first responders. We found a big increase in mental and behavioral health reports from about 4,000 to 10,000. Suicides have been a little less nuanced, the increase, but they've also increased a bit. And then the last thing, we built this, what we call a Wellbeing Interactive, which is just simply an interactive map where you can look at the state level well-being trends, so stress, optimism, worry for both minorities and for whites. And then you can look at the county level death rates, both deaths of despair and now COVID mortality rates, as well as some other controls, and see where are the places that have high levels of both these things that also have low levels of well-being. And one of the interesting things with that is you often see states where you wouldn't expect high levels of deaths of despair, like California, and you find a couple of counties that are ridden with them. And sometimes they're migrant workers, sometimes they're Native Americans. And then you find other places like Kentucky that has everything bad you could think of. They have deaths of despair, they have COVID, they also have terrible racial relations, and they have very high levels of both kinds of mortality. So, and this is just an example of how you can see the deaths of the darker reds are where they're the most deaths of despair. Not to be too graphic, but in the West, they tend to be by gun suicide. And on the East and Southeast, they tend to be opioid deaths. So there's a very clear story about place, which is hard to analyze in any kind of robust econometric way, but there is something about place that seems to reinforce these vicious cycles. So I won't go into this in depth, except that we've been doing some survey work of the aspirations of young adults. We started in Peru just because I'm from there and can work with the people that do the Young Lives data there and a number of other things, and find incredibly high aspirations for higher education, not just college, but even postgraduate education among these 18 and 19-year-old kids in a sort of peri-urban area that's part still, dirt roads and buying water from trucks, part has really expanded and has a metro. But more importantly, they just, 85% of these kids say they're going to college or post-grad, and we've returned 2 years later, and most of them are meeting their goals. And there's a story about place, there's a story about belief in education, and there's very much a story of social capital. So the parents of these kids are all truck drivers or domestic servants or carpenters. None of them have gone to college, but they believe in college. They want their kids to get educated, to do better than them. And if you look at, there's some wonderful work by Andrew Cherlin on interviewing whites and blacks and how whether they live better or worse than their parents did. And the majority of low-income whites say they live worse than their parents did. They're less likely to trust the government. They have lower levels of life satisfaction, a number of other things. Versus minorities, both blacks and Hispanics are much more likely to say they live better than their parents did, which is probably true. And they still have belief in higher education. And so one of the things going on in the US that's incredibly troubling is that, well, part of it's optimistic, even though it's harder for minorities to get to college. The belief in higher education among minorities is still very high. I've even interviewed heads of historically Black colleges on this. And poor whites are very skeptical about higher education, increasingly so, in part because their parents didn't have to go to college to get good manufacturing jobs. But now with just a high school education degree, with a quarter, you can buy a Coke and that's it. There are just very few jobs now for people with only a high school degree. But poor whites really don't believe in it. And that's been sort of wrapped up into the current political tragedy, really, in our country. So they're also now less likely to believe in science. College is an elite plot. And that reinforces their vulnerability to being manipulated by people like Trump and in a lot of other ways. Interestingly enough, we've been doing these surveys in poor Black neighborhoods and poor white neighborhoods in St. Louis County, Missouri, which has all sorts of problems. But one of the things we find is that even though it's harder for the African-American kids to graduate high school, they have lower graduation rates, conditional on graduating high school, the Black kids are much more likely to pursue college, to go on and pursue college than are the white kids. So that reinforces that, there's just something going on, including, very unequally shared well-being, but that there's sort of a structural change that's splitting up the US in lots of different ways, but that's resulting in this very desperate cohort with no future that also unfortunately seems to vote for nefarious politicians, which is, that fits into the classic literature on when people vote for extremists. But the newest and most interesting finding is that despite high incidences of COVID, African Americans report more optimism and better mental health, both in May of 2020, April, May of 2020, and we just have the Wave 2 data, and their optimism really hasn't changed. The optimism of rich Blacks has fallen a little bit, but Blacks are still on average more optimistic than whites. And they're even more optimistic in the face of job loss, people who report to have lost their job. So anyway, let me just show you a couple of tables, and then I'd like to open it up and see what more we could possibly do with this survey. So these are marginal effects based on OLS regressions, controlling for the usual range of things. And this is just on the left panel is life satisfaction, and on the right is this 5 years in the future question, which we use as an optimism question. And as you can see, you go from low to high income on the charts. Low income Blacks are the group with highest levels of life satisfaction. And their, the confidence intervals are big enough. But more importantly, look at the gap in optimism, which is really quite substantial. And that's what we found pre-COVID in our early surveys. But I was pretty surprised to find that this held in a pandemic that was hitting low-income Blacks more than any other group. This is reported mental health. How was your mental health 3 months ago, basically before the pandemic? I'm not sure that's a great question, having them recall mental health by 3 months. But what they were trying to do, I wasn't a fan of this question, but I don't have veto power. They were trying to have a gauge of mental health pre-COVID. I don't know how robust it is, but you still get the same pattern for Blacks, but reported better mental health. And the current reported mental health has even a bigger gap. And again, the gaps are biggest at the low income side of the screen. And then this is if you lost your job. So no, on the left, you haven't lost your job. And on the right, you've had a job loss. Very simple yes or no question. And now for some reason, the colors have flipped and the Blacks are the red ones. But as you can see, quite a gap in terms of resilience to job loss. Life satisfaction in 3 months, which is another question I don't like, but they're trying to do the same thing. And then the 5-year question where the gaps in optimism are really big. So then the puzzle is, does this play out in one? We do know in the Wave 2 data that these gaps are quite persistent with some subtle changes. But so that means that after this was in the beginning of the COVID pandemic, we then had the George Floyd protests and violence and lots of things that could have affected the African American community. And I remember sticking my neck out and predicting that still their optimism wouldn't change. They might get more anxious, but their optimism wouldn't change. Also in the Wave 2 data, we've seen increases in anxiousness, loneliness, a bunch of other things. But again, poor Blacks are the least likely. Blacks in general have the lowest levels of these reported, ill-being markers in Wave 2. So we had George Floyd, also, a very nasty sort of wave of political violence due to police violence against Blacks, and still you get remarkable resilience to it. This is a very sticky finding. I also looked at pre and post Trump to see if Trump's election would change poor Black optimism, and it didn't. And then we did one thing with an older Gallup panel where we looked from 2012 to 2017 and found that the same respondents that were optimistic in the beginning of the panel had actually done better in lots of ways. They'd done a little bit better in terms of financial well-being. They'd basically done better, and they were still reporting high levels of optimism 5 years later. And that was, after, again, a very messy and an election with a lot of negative racial overtones. So then here's one puzzle is, so do these attitudes affect uh, sort of compliance with social distancing behaviors? And here we do have some puzzles. On the right, it's not a puzzle. You just see that whites, because of their individual right to, I don't know what, won't wear masks. And it's become one of the most politically divisive issues in the United States. So the governor of South Dakota, a rather unintelligent woman called something Noam, or is her last name. South Dakota now has the highest mortality rate in the world from COVID, and she refuses to implement a mask wearing guideline, not even an order, a guideline. It's incredibly ideologically driven issue. I wish I could understand it. But ignoring that, you'll see that Blacks, especially high-income Blacks, are very compliant in terms of some of the social distancing behaviors. The problem with poor Blacks is they can't stay home. They're essential workers. If they stay home, they're going to starve. And poor Hispanics have a similar problem compared to poor whites, many of whom are out of the labor force and don't have a problem staying home. And this one's also quite interesting. Again, poor Blacks have a very hard time keeping 6 feet away from each other. They tend to live in crowded places and in intergenerational families with a lot of people in the home. So it's just more difficult. Same goes with avoid gathering. Another issue there is that there's a very strong communal tradition, particularly among low-income Blacks, a very strong Baptist church culture. And that seems to be preserving of mental health, but it runs against sort of avoiding gathering and some of the social distancing behaviors. So it isn't so much a puzzle, it's just, I'm not sure what you do about it. And then finally, inform your symptom, and low-income Blacks are the least likely to say they would, let people know that they'd had symptoms of COVID. And I think that stems from two things. One is that if you're an essential worker and you report symptoms, you're likely to lose your job, which you can't afford to do. And they're much less likely to get good health care and to trust the health system for obvious reasons. So, I think that creates a whole lack of trust dynamic that, lowers their probability of informing people if they have symptoms. So I don't think I need to repeat all this, and just sort of say, COVID has exposed so many deep vulnerabilities in the US, and in particular our really bad healthcare system, in particular mental health care. I wish we could borrow Richard Layard for a little while, have him come over and run things on that front. But we're also a country where health insurance is tied to jobs. It's absurd. So when these people, when you think about the disincentives to report your symptoms for low-income Blacks, they lose their job, they lose their health insurance. We have terrible safety nets, and now the first sort of payments that were designed to support people during COVID have been out for several months, and there's still no renewal of them yet due to political division. So this has been a big hit. We've seen, I'm not going to go through all the markers. I've sort of mentioned them already. Basically, there's been a big increase, not just in ill-being, but also in the gaps between rich and poor in terms of ill-being, where we see the increases higher for low-income people than for high-income people. I've read some stuff about the UK's trends, and that seems to accord in the same way. The only thing that, maybe to conclude on something a little bit more positive, the US has always been a laggard in terms of incorporating well-being metrics into its official statistics. I was on a National Academy of Sciences panel when the ONS 4 were in process and being developed, and we actually worked together as two teams, and then the train left the station, and in the US we stayed in the station without well-being metrics in our surveys. But now, because of COVID, we're starting to see a flurry of interest in getting these markers into official surveys. I've been reviewing surveys for the Federal Reserve Board, for CDC, HHS, for the Bureau of Labor Statistics, the Consumer Finance Protection Board. Um, there's another one that I've forgotten, but so all of a sudden this may, I mean, it's a huge tragedy, but it has, I think, opened the door for us to maybe make some more headway getting well-being into our policies and statistics, and certainly with a new administration that's very likely to be open to it.